Hi, I'm Jess from the Avalon, and we're proud to be back in partnership with Choptank Community Health with our program to help inform and address some of today's important and pressing healthcare topics. And so today I'm here with my new friend, Vicki Rahenkamp. She is the Director of Behavioral Health Services at Choptank Community Health. And today we're going to talk about mental health.
Yes, good topic.
Yeah, and so it seems like mental health is all over the place. Everybody's talking about it. So, why is it so important?
So, mental health is a big topic, right? So, I like to tell people to think of mental health as your emotional well-being. We go to the doctors when our body feels out of whack. Mental health is our mind feeling out of whack. Our emotions are a little bit out of whack. And I think it's a big topic today. Because of COVID. So we have noticed that people's emotional well-being has been out of whack over the last 2 years. COVID, we've seen a big rise in referrals for mental health treatment, especially amongst the adolescent, teenage population.
How do you know when you need help? Really, who should be eliciting help and when? And it's really a scale, right? I think everybody needs a little bit of help. We were talking about that earlier, but there's a range to crisis level help. So how can you self-assess when it's time to pick up the phone?
So think about what I said, right? Emotional wellness. So everybody kind of has an equilibrium, that middle ground where you're good, everybody gets sad, everybody gets anxious, but when things are just really out of whack for you, normal stressors won't go away because you don't know how, your normal coping skills aren't going to help with that. That worry keeps going on even when the stressor is gone. Feeling a little sad, not wanting to do the things you used to want to do. Maybe overeating a little bit, maybe not eating at all. Being fearful of going out in public. Those are all reasons. Sad, being sad, right? Grief and loss. Change in life, lose a job, children move out of your house, all those are all things that can throw that emotional well-being off for you. And it's always helpful to go to talk to somebody when you're feeling that way.
Or build those relationships even when you're feeling good so that you have that emergency button you can push when you need it. So let's say I'm in a position where I have decided that I'm in one of those life situations where I'm just not feeling steady. Mm-hmm. What's my next step? How do I connect with a mental health professional? How would you do it?
So everybody's community has some kind of professional behavioral health program. Here on the Mid-Shore, we have a lot of really great outpatient mental health clinics. A lot of primary care facilities are offering behavioral health as part of their treatment now. There are a lot of really great private practice clinicians in our area. One of the easiest ways to find somebody right off the bat is to call your insurance company. And they will give you a list of providers in your area that take your insurance, because that's important for a lot of people, right? Call your insurance company. Mid-Shore Behavioral Health is our core service agency here on the Mid-Shore, and they kind of oversee all the behavioral health programs in the area. If you reach out to them, they can give you a list of providers in the area. They may even be able to tell you what wait times are for all those providers. Trying to think of other things. Call your primary care. They often have a list of providers in the area. A lot of jobs have what are called EAPs, which are employee assistant programs, and they can offer you some, 3 to 4 sessions that
would be a great
you can have for free.
So basically, call your insurance company or go to your insurance company's website, talk to your primary care physician, see if your employer has resources that can be deployed, or reach out to Mid-Shore Behavioral Health. So that's a huge step. You've self-identified that maybe you need help. You are finding the help. Now, I think what a lot of people wonder, Vicki, is what should you expect when you cross that threshold and meet with your mental health professional for the first time? How scary is that first meeting?
If the first meeting is scary, you don't want to go to that provider, right? It shouldn't be a scary situation. Think about hiring a childcare provider, right? You interview them. You're going to interview that provider. That first meeting is about that. meeting with that person, getting in to see if you're a good fit. You have to be comfortable with your therapist. That's the number one important thing when you're starting treatment. So you're going to meet with that therapist. They're going to ask you some questions about, what have you been dealing with? What are those emotions that you've been feeling are a little off right now? What life changes have just happened for you? What are you looking for? Do you want to come to therapy once a week? Are you looking to do it once a month? They're going to do an assessment, a really quick assessment, probably at that first meeting, just to get an idea of what services you need. And then they're going to talk to you about what that treatment plan might look like. What are we going to do moving forward?
I think that is really great advice. So make sure that when you do cross that threshold, that you are really using it as an opportunity for you to interview your mental health provider as much as providing information to them, just to make sure that you're finding yourself in a safe space to get the kind of coaching and help you need. Vicki, it's been great to talk to you. This is again, Ask a Provider, which is a partnership between the Avalon Foundation and Choptank Community Health. It was great talking to you, Vicki. Thank you.
Thank you for having me on today.